Welcome to A Learning by Parul Institute of Ayurveda. Today we will learn about Agni Karma. Importance of Agni Karma Ksharadagnirgaryan Kriyasu Vyakhyata Tadagdhana Roganam Punarbhavat Bhejdashastra Sadhyana Tatsadhyatwach fire cautery treatment has been described to be superior to the caustics, as the diseases treated by it do not relapse and moreover those incurable by medicines, operations and caustics also yield to it. Instruments used in cautery. The following upakaranas are the means of burning such as pitpali, goat species, cow's tooth, bana, arrow, shlalaka, rod, dimbavanstha and other metallic like iron, silver, copper instruments along with honey, treacle and fatty substances. Among them pipali, feces of the goat, the cow's tooth, arrow and rod are used for cauterization of the skin lesions, dimbavavka and other metallic instruments for muscular lesions, and honey, treacle and fats are used for the lesions of the vessels, the ligaments, the joints and the bones. Suitable seasons of Agni Karma cauterization should be done during all the seasons except autumn and summer. Even in these seasons, during emergency states amenable only to cautery, it may be used after taking appropriate countermeasures against them seasons. Preparation of patient in all diseases. During all seasons, the operation cautery should be done after feeding the patient with slimy diet, and on an empty stomach in cases of malpresentation, calculus disease, fistula in ano, abdominal diseases, piles and diseases of the oral cavity. Varieties of Agni Karma. According to some, Agni Karma is of two types. 1. Skin cauterization. 2. Muscular cauterization. But here in surgery, cautery is not contraindicated even for the vessels, ligaments, joints and bones. Criteria of successful cauterization. Skin cauterization. When the skin is cauterized, burning is attended with a cracking sound, bad odor and contraction of the skin. Muscle cauterization. When muscles are cauterized, there occurs a pigeon-like discoloration of the part, mild inflammation and pain and the lesion gets dried up and shriveled. Vessel and ligament cauterization. When the ligaments in the vessels are cauterized, there occurs black discoloration, swelling of the lesion and a cessation of discharge. Bone and joint cauterization. When the bones in the joints are cauterized, there occurs dryness, redness, hardness and fixity of the lesion. Indication of cauterization. Cauterization should be applied when vitiated vayu has afflicted the skin, muscles, vessels, ligaments, joints and bones and is associated with severe pain, in ulcers with excessive granulations, indurated tissues and anesthetic patches, in lymph nodes, piles, tumors, fistula in ano, warts, pigmented moles, diseases of joints and vessels, and it should also be applied in excision, tracts of sinuses and in cases of excessive bleeding. Patterns of Agni Karma. Tatra Valay Bindu Vilekha Pratisarananiti Dehna Vishesha. These are circular, dotted, linear and flat designs of cauterization. Pre-cautery assessment. The surgeon should apply the cautery treatment only after a thorough examination of the shape of the lesion, the related vital parts of the body, strength of the patient, the disease and the season. Post-cautery management. After proper cauterization, honey and grit should be anointed over the wound. Contraindication of cauterization. Cautery should not be applied to those having pittika constitution, internal bleeding, ruptured viscera, unextracted foreign body and in the weak, the very young and the very old, the timid, in those having multiple lesions and in all those in whom the fomentation treatment is contraindicated.
Created using Powtoon.